To enable fast, efficient responses to emergencies, the FDA developed a network of 24 state-based rapid response teams. As multi-agency, multidisciplinary teams, rapid response teams quickly coordinate the efforts of partner programs that may have overlapping or neighboring jurisdictions, leveraging the resources of local, state, and federal partners for common public health goals. These teams have become valued partners in responding to outbreaks from contaminated human and animal foods, conducting large-scale recalls, and ensuring availability of safe foods during a natural disaster.
I'm Randy Treadwell, and I'm the Rapid Response and Emergency Management Program Manager at the Washington State Department of Agriculture. The Washington RRT has allowed us to not only tap into, but help develop a nationwide network of subject matter experts. Because of the close-knit network, we can really easily reach out to them if we're responding to a similar incident in our state. So for us in Washington, the network is what we really see as a valuable public health tool in battling foodborne illnesses in the U.S.
In the fall of 2019, an outbreak of E. coli 0157H7 sickened 167 people from 27 states. E. coli outbreaks linked to leafy greens are a recurring issue. The Maryland and Wisconsin rapid response teams played a critical role in this national outbreak investigation. Michelle Boyle, FoodNet epidemiologist with the Maryland Department of Health.
On November 6, 2019, the Maryland Department of Health was notified by the Baltimore County Health Department of 2 cases of STEC from individuals who reported eating salad kits from a local big box store. On November 18th, the Maryland Department of Health reported that E. coli 0157H7 had been isolated from the salad kit.
James Bikes, Recall and Emergency Response Coordinator with the Wisconsin Department of Agriculture, Trade, and Consumer Protection.
On December 6, 2019, Wisconsin Department of Health Services announced that E. coli 0157H7 was identified in a sample of unopened green romaine salad purchased by an ill patient. The retailer that sold the product advised the complainant to contact the local health department about the potential sample and alerted state officials so that they could work with the local health department to coordinate sample collection and laboratory analysis.
Asma Madad, epidemiologist, Core Response Team 2, FDA.
The E. coli 0157H7 recovered from the positive Maryland and Wisconsin samples was found to be highly related genetically to the outbreak strain. Swift action by RRTs to coordinate sample collection, provide laboratory analytical packages, as well as conduct rapid traceback on the positive samples, provided the necessary evidence to support the narrowing of the FDA and CDC consumer advisories to the romaine from the Salinas Valley growing region. This therefore avoided the need for a broad recommendation against consuming any romaine prior to Thanksgiving, and therefore also benefited consumers and industry.
Each year, rapid response teams gather to share accomplishments and best practices. The meeting features a poster session showcasing notable accomplishments and high-profile investigations from the past year. Along with the meeting summary, posters from past meetings can be viewed on the Association of Food and Drug Officials website at www.afdo.org/resources/RRT-program. The virtual 2020 meeting presented several posters, including an outbreak of E. coli 0103 traced to sprouts, implications for the FSMA produce safety rule, multi-state scombroid outbreak associated with tuna, a Rhode Island perspective, Minnesota Rapid Response Team Fiscal Year 2020 highlights. Through integrated and coordinated efforts, the rapid response teams respond to hundreds of contamination events each year, conducting joint investigations, tracebacks, sample collecting, and root cause investigations. Their proactive, multi-agency efforts are often key in determining the cause of large-scale outbreaks and identifying contaminated products within a national or international web of food distribution, and ultimately protecting the public health. For more information about rapid response teams, please visit FDA's website at www.fda.gov.